Many Canadians know what type 2 diabetes is and the devastating effects it can have on the body, such as heart disease, loss of vision, amputation, and the constant need to check one's blood sugar levels. But fewer Canadians are aware of prediabetes, a condition where blood sugar levels are high, but not quite elevated to the type 2 diabetes level. Left unchecked, prediabetes can progress to type 2 diabetes in the near future. So right now, about 6 million Canadians have prediabetes. That is a large segment of our population, meaning that so many people are currently at risk of developing type 2 diabetes. I'm Dr. Mary Jung from the University of British Columbia and founder of Small Steps for Big Changes, a diabetes prevention program run in partnership with the YMCA. Join me and my team in this series of videos. We're going to teach you how to prevent type 2 diabetes, learn if you may be at risk for type 2 diabetes, and how you can stick to healthy behaviors, including diet and physical activity. Even if you don't have prediabetes, sticking with a healthy diet and regular exercise can reduce your future risk. Now, I think one of the scariest parts about these statistics is that 9 out of every 10 Canadians living with prediabetes aren't even aware that they had it. It's very difficult to take action if you don't know what you're at risk of. So, even if you're not sure, I encourage you to check in with your doctor to assess your risk of type 2 diabetes. Or you can ask yourself the following questions. Are you over the age of 40? Are you a man? If you are a woman, have you ever been diagnosed with gestational diabetes? Has anyone in your family ever been diagnosed with type 2 diabetes? Do you have high blood pressure? Are you overweight? Are you physically inactive? Now, if you answered yes to a few or more of these questions, it's time to seek advice from your doctor. A prediabetes diagnosis should be taken seriously because some long-term complications associated with diabetes, such as heart disease, do begin during prediabetes. Now, the good news is that the most potent ways to prevent type 2 diabetes are in your control. Making changes to your diet and exercise behavior is twice as effective as the leading drug at preventing the progression from prediabetes to type 2 diabetes. Now, in reality, we know that is easier said than done. Small Steps for Big Changes coaches can help you work through the daily challenges that make sticking to a healthy diet and regular exercise difficult. So continue watching this series to learn important elements in the behavior change process. Stay healthy and happy, and remember, small steps can lead to big changes.